Today, we are going to see a new topic, which is calcium and phosphate metabolism. We'll start with calcium metabolism. First, we'll see about the functions of calcium. Calcium is important in the formation of bone and teeth. It plays an important role in the clotting mechanism, muscle contraction, and maintenance of the stability of the membranes. The source of calcium is milk, vegetables, fruits, and cheese. The recommended dietary allowance for calcium is 0.5 to 0.8 grams per day, but this increases during lactation. Lactation requires the highest calcium when compared to pregnancy and the normal values. Calcium is absorbed in duodenum, and the absorption of calcium is decreased by phytates and oxalates and increased by vitamin D, fat, citrates, proteins, and low pH, and it is excreted in urine and feces. The normal blood levels of calcium is 9 to 11 milligrams per 100 ml, and it is stored mostly in bone. Now we will step into the important topic, which is regulation of calcium or calcium metabolism. Three important factors play a crucial role in the regulation of calcium. They are parathormone, calcitonin, and vitamin D. First, we'll see about the parathormone. Parathormone is the hormone of the parathyroid gland, otherwise called PTH. The basic action of parathormone is to increase the blood calcium. Parathyroid hormone is inversely proportional with the blood calcium levels. That is, if one decreases, the other increases. So the main action of PTH is it increases the osteoclastic activity in the bone. It increases the calcium reabsorption in kidneys. It increases the calcium absorption in intestines. It increases the 25-hydroxycholecalciferol conversion to the active form, 125-dihydroxycholecalciferol, otherwise called calcitriol, and it decreases osteoblastic activity. In other words, all the actions of parathyroid hormone focus on the increase of the blood calcium levels. Now coming to the vitamin D action. The vitamin D that is taken in the diet is ergosterol or 7-dehydrocholesterol, and this in the presence of UV light from the sunlight in the skin gets converted to ergocalciferol or cholecalciferol. This goes to the liver and in the presence of hepatic 25-hydroxylase gets converted to 25-hydroxycholecalciferol, and finally in the kidney in the presence of renal 1,2-hydroxylase gets converted to the active form, which is 125-dihydroxycholecalciferol, otherwise called calcitriol. The main action of vitamin D is it increases intestinal calcium uptake, increases the bone calcium mobilization, and increases the renal calcium reabsorption. So it's an excellent regulator of calcium levels. Now coming to the third important factor in the regulation of calcium, which is calcitonin. So this action is completely opposite to that of parathyroid hormone. Calcitonin basically reduces the blood calcium level. So calcitonin level is directly proportional to the blood calcium levels. When one increases, the other also increases. So the main action of calcitonin is decreases osteoclastic activity and increases bone formation in the bone. In the kidney, it increases calcium excretion and decreases calcium reabsorption. In the intestine, it decreases calcium absorption. In other words, all its actions focus on decreasing the blood calcium levels. There are other hormones involved in the regulation of calcium, which is growth hormone, estrogen, and prolactin, which increase the blood calcium level, and insulin thyroid hormone, which decrease it. Now coming to the phosphate metabolism. First, we'll see about the functions of phosphate. Very important in the formation of bone and teeth. Plays an important role in the fat and carbohydrate metabolism. Plays a very crucial role in the ATP formation and nucleic acid formation. The sources of phosphate is milk, meat, vegetable, and fruits. The recommended dietary allowance is 550 mg per day. It increases during pregnancy and lactation. Absorption and excretion of phosphate occurs in duodenum and urine respectively. The absorption is increased by calcitriol and decreased by the presence of iron calcium. Metabolism. The same three factors play an important role in the metabolism of phosphate. Coming to parathormone, it increases the phosphate excretion, decreases the phosphate reabsorption. So here the action of parathyroid hormone is opposite to that of calcium. Vitamin D, it decreases phosphate reabsorption. Coming to the applied physiology, deficiency of calcium results in tetany and rickets. Thank you.